Hi, today we will talk about kidney cancer. What causes it? How can we know we have a problem? And what do we do about it? So kidney cancer is not a common cancer. It usually affects people over the age of 60, but rarely we'll see young patients. It doesn't usually run in families. Most people who get it are older, and they usually have had a history of smoking. Smoking is a known risk factor for that. Obesity is another one. And hypertension, if somebody had it for many years. There's some debates as to whether taking over-the-counter pain pills like Tylenol and Aleve and ibuprofen can do that. It's not clear, so I wouldn't say I would be too worried about it. How does somebody know they may have kidney cancer? So that's interesting. Early on, somebody can have blood in their urine, so anybody who has blood in their urine needs to have that checked out. That's never normal. There's always something wrong. It doesn't have to be cancer. It could be an infection. It could be a stone. But pink blood is not normal, and that should be checked out. If somebody has advanced kidney cancer, they may have tiredness. They may have fevers. They may be losing weight, not having a good appetite. Or they may just have pain at the back. I don't know if you know where the kidneys are. They're at our back. So if it's on the right or the left and you have pain there, that should be checked out too. How do we find out kidney cancer? Usually you go to the doctor and they do a scan. In fact, most of the kidney cancers are now found in people who are doing a scan for something else. Let's say you have a stone or a gallbladder problem and you do a scan. We often find a small kidney tumor at its early stages sort of by accident. So once the doctor finds the tumor, they do more tests to make sure it's not spread. If the cancer is localized, it is highly curable with surgery. And in fact, most of the kidney cancers are found early. So somebody would have a surgery. The extent of the surgery depends on how big is the tumor and where on the kidney is it. For the last 10 years or so, we are performing mostly minimally invasive surgeries where people lose half of the kidney or 1/3 of the kidney. But sometimes the surgeon does have to remove the whole kidney. If the cancer is not spread beyond the kidney, that's it. You're done with the surgery. In some high-risk cases, people would come to the oncologist for some additional therapy to try and prevent the relapse of the cancer. If, on the other hand, we find the cancer at advanced stages where it's spread away from the kidney, that's called stage 4 cancer. That is not curable, but it's treatable. And the treatment nowadays is mostly immune therapy, which is not chemotherapy. It's very different. Immune therapy activates parts of the immune system that go out and fight the cancer, and has really revolutionized the outcomes in kidney cancer. People now can live many years, and in fact, some who are very fortunate can have the cancer completely eliminated with immune therapy and live for many years without any evidence of the cancer. So the important thing is to know that it can happen, that if you have any blood in the urine or the symptoms we discussed, to have it checked out. If somebody checks it out early, they're more likely to find it early and have a much higher chance of getting rid of it and being cured. Thank you.